We'll move on to our final speaker, and then we'll have time for questions. Dr. Maya Negev from the University of Haifa. Can I give you the floor, please?
Yes, thank you. Good afternoon, everybody. And thank you for the opportunity to participate in this fascinating panel. And I'm hoping to contribute the heat and health angle, which also corresponds with much of what has already been said. But I would like to start with a short story. Howard, back in the early 20th century, already recognized the importance of open spaces of different types to health. And he didn't need environmental epidemiology or other very advanced science to know that. And he designed the concept, the wonderful concept of garden cities with residential housing surrounded by forests and vegetable gardens and canals, etc. This wonderful concept, there was an attempt to import it to Israel, to Beersheba, which is the capital of the desert in Israel. And the 1950 urban plan of the city is based on this concept. However, what the urban planners did not take into consideration is the local climate, the local temperatures, and the local precipitation and water availability. And we ended up getting a city with clusters of neighborhoods separated by either just brown fields or parking lots and with no gardens. And actually the concept obviously did not work in the desert. So I'm going to talk today about how concepts of adaptations of cities should be adapted to local contexts with the example of dry and hot areas. These are images from a shopping mall also in Beersheba, which is fairly low emissions. So you can see that it's an open mall, so it reduces significantly the air conditioning needs. Only the shops are air conditioned. And using mainly artificial shading in order to get shade, because trees are heavy water consumers and they're not always possible in the desert. And also using ceiling fans, both indoors and outdoors, to make to achieve thermal comfort. And this is quite significant improvement of the thermal comfort with lower emissions relative to air conditioners. This too, by the way, works better in dry zones than in humid zones. So I would like to spend the first few minutes talking about why heat and dryness are a dual challenge to designing healthy cities and which populations are more vulnerable in these respects. And the second part of my talk to how we can facilitate healthy dry cities. Okay, this is my must-have trend graph of climate change that I guess each talk in this panel and in general on climate change opens with, and I chose the one of the Mediterranean temperatures here. And we can see that the global warming is about 1 degree, on average in green, but in the Mediterranean, we are already 1.5 degree above the baseline. So it's getting here hotter faster. And this is true in any RCP. And it's also getting drier. So precipitation trends are actually declining. We are going to have more extreme water events. So floods are definitely an issue here. But in general, the message is hotter and drier. And this is a challenge for healthy living in cities and for urban planning of such cities. So the obvious problem is that we cannot have green and blue spaces or even green roofs as is recommended as an adaptation measure due to the water shortage and also because we have rain only about 4 months a year. This is connected to physical inactivity. We know that green spaces increase physical activity. and is also related to poorer mental health. Again, we know, according to research, that living near a green or blue space contributes to improve mental health. Another issue is the poor water quality. And from a landscape design perspective, you can see here, it's actually right to left because it's in Hebrew, but this graph shows how many months the city of Tel Aviv waters its parks. And you can see that in the past 15 years, they have already gone up from 6 months to 10 months of watering on average. This is a problem for all cities, but it's an extreme problem for the lower socioeconomic cities. And we can definitely see the gap between different cities and different countries in their ability to water open spaces in dry areas. Another aspect, and this is related to Professor Shi's wonderful talk, is that when it's very hot, people are less active. So the active travel that we've heard about with public transportation and bicycle and walking, it not only reduces air pollution, it also improves health by reducing obesity and diabetes, and in general, making people healthier and moving on from sedentary life. So the concept of public transport and active transport is, of course, very much needed, but it is much harder to achieve in a hot city. For example, Tel Aviv, and we see here the promenade, which is very beautiful, but most of the summer degrees around like 35 Celsius probably. In the summer, people will not walk, people will not cycle to work because they don't want to get there sweating. And public transport is also a challenge that I will relate to. Also, recreational activities are going down, and social cohesion is a challenge when it's too hot to be outside. So these are all limits on healthy lifestyle. And the other kind of pathway of public health research shows the association between heat and increase in different types of diseases, especially among the elderly, and also in aggressiveness, domestic violence, other violence. Anybody who's been in hot weather, and I've experienced it several times, of course, feels more aggressive, aggressive, and it impacts us, and it can also lead to violence and to suicides, which are increasing in hot zones. I would like to take a minute to focus on the heat-related mortality among the elderly, who are the most vulnerable population to heat. And according to the Lancet countdown, in the past 15 or less than 20 years, heat-related mortality increased by over 50% globally among the elderly. And this includes, for example, from cardiovascular, respiratory, stroke, heat stroke, and other diseases and health conditions. We can see that the annual number of deaths are spread globally, and this happens both in the global north and in the global south. But obviously, the poorer are more vulnerable. So in this context, energy poverty means those who do not have the means to cool, and in other contexts to heat, of course, or to cook in a health protective way. And we see that many people either do not have the means to isolate the house or have an air conditioner, or if they have an air conditioner, don't have the means to use it whenever is needed. On top of that, there is an occupational vulnerability, which I think we are very much worried about, because people who have to work outside are exposed to dangerous heat, and this includes construction builders, agriculture, and many other outdoor jobs for people who don't necessarily have a means to protect themselves, and they are in danger due to their work. And this is definitely an occupational health concern. Unfortunately, In the Middle East, we have not yet started to, I mean, we've maybe started, but we've not yet fully embraced the concepts of adapting urban planning to the local context and to the hotter and drier context. We can see here a fairly new, very beautiful park in Jaffa, near Tel Aviv, but it was really designed with, I think, North European or West European approach of a lot of green and some trees, and we can see that in the summer, people just don't use this park because it's too hot. I said I will relate to public transport, and we see across the Mediterranean and the Middle East that public transport stations are not designed to protect from heat. And therefore, again, anybody who can uses cars. Of course, in our region, public transport is also not always reliable, so you may also wait quite a while. And people are exposed to heat sometimes in the middle of the day for a significant amount of time, which is a barrier for using public transport. The materials that cities are made of are very important, and due to the lack of water, there is a trend, at least in Israel, to use artificial turf, for example, in playgrounds. However, when temperatures are measured, we see that the turf, and these measures were taken at 11 a.m. on a summer day in Tel Aviv, the turf is 70 degrees Celsius. That actually can cause a burn. And we see that the slide is almost 50 degrees. So when we have shade, the temperatures are a bit more comfortable, at least not dangerous. But shading is definitely a major issue, a major concern that is hard to achieve. And we see that trees make very comfortable temperatures. In these thermal images, we can see that trees or shading from building can reduce the temperature by even 20 degrees, but most landscapes, most urban landscapes, most of the parts of the city are not shaded, and most of them are dark materials, dark colors, which is not reflective, and it absorbs more heat and heats the city. So to summarize the problems part, and this is from a paper that we've published in a British Medical Journal, there are 10 golden concepts for healthy cities that you can see in green, and most of them have a specific challenge in dry cities, whether it's achieving clean air or water, comfortable temperatures, green and blue public spaces, and many other aspects. This type of cities and hot and dry climate we can see in many continents and many countries in the world have a specific challenge in adopting the nature-based solutions that have been rightfully suggested for temperate climate. Can urban design cool the city? The answer is yes. I will show a little bit how buildings, shading, and vegetation can mitigate the urban heat stress. But if we look at the level of urban greenness in large cities, I think this is about above 1 million inhabitants, we see that there is a lot of inequality between cities, with cities, for example, in the Middle East and in South America. Some of them have very low levels of urban greenness, which is obviously not a good starting point. Here in this figure, from another paper that we've published in the same BMJ special issue on healthy dry cities, we show the concepts of urban planning that are suitable for this climate. So the blue and the brown bars are the environmental conditions, and all of the others are city, street, building, and human scale adaptations that are suitable for these cities. And we will zoom into the city and street and building scales a little bit. I will not talk about the human scale today because it's less related to the context of this panel, but also people can reduce their exposure to heat by taking individual measures. A lot of the urban farm strategies that are already being promoted for healthy cities, and we can see here the health benefits, can be appropriate to hot and dry cities, but they require adaptation. For example, if we talk about density in hot and dry cities, the walking distances have to be very short in order for people to actually use them rather than private car. Shade is essential, both on pedestrian and cyclist lanes, because the summer is very long and hot. Narrow streets and courtyards, the traditional Middle Eastern architecture and urban design are suitable. They're a bit hard to replicate on a modern scale, but some of the concepts can be adopted and cities can be designed in order to have ventilation and wind canyons. And we saw in the previous talk some examples of how airflow can be improved by urban design. If we look a bit more at the urban planning level, then one of the issues that is of a concern is how we design the landscape with little water. And one of the ways to provide for the citizens healthy landscape that will contribute to their mental health and that will encourage them to be physically active, whether in commuting or at leisure and social gatherings, is xeriscape landscaping. So landscaping with plants that are very, very water efficient and do not require watering or require watering on a very limited scale. And as I said, a very important issue is shade, and we see again in this thermal image that the leafy shade effect is very important actually. And actually this morning I was on a field trip with students, and we could sit under a tree and be comfortable, but if we went outside of the tree to examine the environmental health issues that we were talking about, it became unbearable. We felt that it's about a 10-degree difference. So trees are very, very important. But what do you do when you cannot plant trees or water them? Then artificial shading can be as good. And we can use, this is going back again to the shopping mall in Beersheba, we can use cooling towers. This was designed by Professor Arel. I'm not an expert on cooling towers, but I can tell you that the hot water comes in, it's cooled by water evaporation, and the cooler water by about 15 degrees goes out to where people hang out together with a water fountain. This makes an outdoor area quite comfortable. And with shading, and this is again from that model, we can see that microclimate can be quite pleasant, and also in the desert. I'd like to show this specific experiment on the issue of natural versus artificial shading. And here we can see the thermal stress. So it's based on temperature and humidity of non-shaded spaces. And we can see that merely having exposed grass, it reduces the thermal stress to warm compared to exposed bare. So grass reduces thermal stress. But if we add shade, and here we add both artificial mesh shade and trees, we see that both of them make the thermal stress much lower. So shade, in this experiment, shade, whether artificial or natural, was a significant improvement. If we combine shade, whether artificial or natural, with grass, we can achieve, even in the middle of the desert, in the middle of a summer day, comfortable temperatures. The thing is that this is on a micro level. So hot and dry cities should create microclimate in places where people use, gather, or commute, and design the city to enable people to move along microclimates, because cooling the whole city is possible, but not at such a dramatic scale as we saw in this experiment. And this is an example of actually an intelligence army base that is being built now. In this project, they designed shaded path walks between the buildings. It's also in the desert, with some spots for hanging out that are shaded. So taking a very challenging climate and creating microclimate solutions, and also calculating the wind and natural ventilation to encourage breeze. The height of the buildings can be simulated in order to make the airflow most efficient. And of course, the relatively light material, so not white, but albedo colors can also contribute to more reflection. White can actually be like uncomfortable for the eye, but any albedo shades can reduce the temperature and increase the reflection of the radiation. At the building design level, and we see it in many traditional Mediterranean cities, buildings can be structured in a way that shades the whole street, and this can really create a city center comfortable temperatures. So you can see here some more principles: passive cooling, thermal mass, and insulation. All of these can also reduce the usage of air conditioning, which is widely used in our region. I'd like to conclude with a statement that we at the International Society for Environmental Epidemiology, together with the International Society for Urban Health, published for this COP26. And we call here for a better collaboration of urban planners and public health researchers and other stakeholders to understand the health co-benefits of urban planning that adapts to climate change in cities. Basically, we call for a collaboration between these different disciplines that often work in silos, and we call for a collaboration in order to cultivate the health co-benefits and to maximize the health co-benefits of adapting cities to climate change. So one example is if we have several alternatives for achieving any sort of adaptation to climate change, we can team up with public health experts and urban designers and explore how each alternative will impact public health along the different pathways that we've discussed, and achieve a win-win situation. So this is the way forward that we suggest, basically working more together, sharing knowledge, and providing transdisciplinary solutions for the changing climate. Thank you. Over.
Thank you so much. That was really informative and relates really well to the practices of urban design and what we're doing here. I mean,